When you have a client with confusing symptoms, but none of the usual traumatic events, consider the possibility of preverbal trauma. This may turn out to be a complicated birth, or it may have been invasive surgery, a stay in the intensive care unit, neglect, or abuse. Ask about the possibility of a trauma in utero. For example, a pregnant woman who is being battered produces hormones that directly affect the baby. Science has proven the brain is recording implicit memories as early as the 3rd trimester of development. We find it helps to start trauma processing with one's birth, even if the person knows little about it. People draw what they think may have happened at birth or in utero based on stories they have heard from family history. More times than not, the stories are affirmed by friends and relatives. Infants who have experienced preverbal trauma often develop PTSD. Yet later in life, they may be misdiagnosed with a personality disorder since they have had problems from when they were very young. Their difficulties often turn out to be unprocessed preverbal trauma. These traumas are not as easily recognized as those affecting the older child or adult, and as a result are usually overlooked. Anesthesia for infants wasn't used in major surgeries such as repair for pyloric stenosis and heart surgery until 1986. Babies were given paralyzing drugs, but no drugs for pain. Infants' nervous systems were believed to be too immature to feel pain. Even if they did feel pain, it was assumed that they wouldn't remember it. To this day, some healthcare practitioners still have this false belief. This website, our app, and our Instinctual Trauma Response Model can be important tools to use in processing these early preverbal traumas without reliving them, ridding the client of the disabling intrusive, arousal, and avoidance symptoms once and for all. You can use this website and app in your office or provide it to your client to take home so you can take full advantage of the face-to-face time you have in sessions. You can have them do the sections recommended to complete the story, process the traumas, and work with their parts. They can email their results to you or save them for the next visit. And of course, we're expecting that you, as the therapist, will learn the methods in the Tools for Therapists section as well as those in the Client section, and will administer the program properly, learn to ground the client when needed, and be the compassionate witness to your client's stories. This model will be useful to you with a number of clients, since the process is the same for any trauma. We suggest you start with the earliest foundation traumas and work your way forward. We have seen that these preverbal traumas can often be the main source of the client's issues, no matter what happened later. We believe that our approach will reinvent the way you approach difficult cases. We look forward to working with you and hearing your results.